everybody. I'm Coach Chris with Fortune Management of Nebraska. Marissa and I have decided to do a series of videos of the most commonly asked questions that came up over the last year for our teams. We figured that if they came up for our teams, then other teams out there are probably asking the same questions. I have been a hygienist for 30 years, so today I'm going to address one of the most common questions I got this year for the hygiene team. And that is, what do I do with a long-term patient that I have been treating with a prophy and they really do need to be enrolled into a Perio program? How do I handle that? We know that the new patient is actually quite easy. The new patient is coming in with expectations that they're going to have a full exam, some diagnostics, and then we're going to recommend treatment for their dental needs. The long-term patient's a little harder, especially since I, like most hygienists, have treated perio while I'm doing a prophy. 1 5mm here, maybe 2. I'll just get that. I'll clean it up. I'll just keep them going. Is that a right or a wrong thing? I don't know the answer. Is it the best thing for the patient? Probably not. Later in my career, I really took on enrolling my patients back into Perio programs or into Perio programs for the first time. And I'm talking long-term, 10, 12-year, been with me patients, and it was not easy. I found that the best way to do this is when I do come across an area of disease, I will stop and I will ask myself 3 questions. 1, is what I'm doing today the best thing for this infection? 2, is what I'm doing today the best thing for my body? As we know as hygienists, we have enough back and neck trouble. If we're trying to do something extra in an appointment, is that the best thing for us? And number 3, is the patient owning their disease? I feel like this is the most important question we could ask ourselves about a patient. And the answer is probably no. In that particular question, what I needed to do was to know, number 1, this disease is not my fault. Number 2, the patient probably doesn't even know that they have this infection or this disease, especially with the language that I would use all along, like, oh, I'm seeing a lot more bleeding in this area, or this area doesn't look as good. I need you to work harder here. That is not saying, hey, you have a disease. So they probably don't even know that there's a real problem. And then 3, is this the proper amount of time with the proper equipment to treat the disease as it is right now? If I answer no to any of those questions, it's time to do something about it. So, is it best for the infection? Is it best for my body? And is my patient owning their disease? I encourage you that the next time you find perio disease in your patient, that 5mm bleeding pocket with bone loss, take your loops off, take your mask off, sit the patient up, and face them knee to knee and have a real honest conversation with them. Mrs. Jones, as you know, the last few times you were in, we've been talking about that area on your upper left that's been bleeding more and just not looking as good as it should. Today we're seeing that what we have been doing is no longer working. You have an infection up there. And before that infection spreads to other teeth or to the rest of your body, we need to treat it. I was so surprised the first few times that I did this that the patient was like, oh my gosh, I have an infection. I need to treat this. And on and on and on and over and over again, the patient would just comply and say, absolutely, we have an infection. Let's treat it. My hygienists that I've coached for the last several years, when they use the language, over and over again, they would come back to me and say, I can't believe this is working. I'm getting the patient the treatment that they need just by telling them that they have a disease. So that is it for today. If you have any questions about this, or if you would like some more help on this subject or any other subject, please do not hesitate to reach out to me. Thanks so much and have a great day.